Good afternoon and welcome to HealthSystemCIO.com All-Star Panel Defending Your EMR in a Court of Law, a webinar tweet chat combo from HealthSystemCIO.com. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the editor-in-chief of HealthSystemCIO.com, and I'll be your moderator today. Kay Gamble, our managing editor and director of social media, is hosting a tweet chat right now on our topic, and you can participate in a separate browser or on your phone by using the hashtag HSCIOchat, and you can view what's going on Twitter in the media viewer panel on the right-hand side of your screen. So just go ahead and open up that panel and you will see the discussion. And also, if you would like to ask a question today, which we encourage, you can do it at any time using the Q&A box. Type the question into the Q&A box and leave the default set to all panelists, and we'll take those later on in the program. And you've got a URL on your deck on your screen. There's also a shortened URL at the bottom of some of our slides, and it will be sent out in the chat box, so plenty of chances to get a hold of the deck. Today we're going to get a featured presentation by Kathryn Krause, Network CIO, Kings County Hospital, the Central Brooklyn region of New York City Health and Hospitals Corporation. And then we're going to have our Q&A with Kathryn. So again, send those questions in as they occur to you. So without further delay, we're going to turn it over to Kathryn Krause. Kathryn, thanks for joining us on this important topic.
Thanks, Anthony. I'm very excited to be here. It's truly a new area that we're beginning to explore as we look at EMR forensics. I believe we're going to be seeing a new profession for people that are architects of the EMRs that truly understand how the data not only goes in but comes out. So I was placed in a position of defending a hospital and some physicians, and when it came to light that not many people understood how the paper chart that came out of the electronic medical record rendered was not as accurate as what was actually in the EMR. So I'm going to walk you through some of the things that I learned along the way, just because I've worked with EMRs and done many deployments of them across the country in my consulting career, and we're currently in the process of rolling out Epic at New York City Health and Hospitals. So I have a lot of experience. I've surrounded myself in the past with great experts that have taught me a lot. So hopefully you can take a few things away from this, and if your hospital is put in a position of having to defend their EMR and explain what happened, hopefully you can take away a few key points that will help you. And in the future, if you need to get some questions answered, I'm happy to be that person that you reach out to. So let's take a look at what to do. Let's first of all define EMR forensics. And when I do my research on the internet and I look it up, most people will talk about things like HIPAA compliance, and that's a very key factor in making sure that your EMR is safe. However, that's not exactly what the EMR forensics means. Part of it is the audit logs. Now, there are many reasons to go into the audit logs, and it depends on which audit logs you're going to be looking at. But in the case study that we're going to be talking about today, I'll address that in a greater detail when we get to that slide. I know that many EMRs have got the ability to pull out audit logs to make sure that HIPAA compliance is met. So you want to make sure that the right people are accessing your EMR, and there are automated algorithms that you can build to make sure that people are not accessing your records unnecessarily. The other thing about an EMR is to provide an accurate record to the patient on request. You know, whether that is on paper or whether it's electronically, it becomes very cumbersome, because when you're dealing with a relational database, as the EMRs are, you need to understand the context in which they need that record. And that goes also for the litigation requests. What is it that this medical record is going to be used for, and what data is key? Because for different use cases, you're going to be using a different subset of the record. So if you're transitioning to another level of care, you may not need all of the details about, you know, the IV fluids, the intake and the output, and the vital signs and those kinds of things. However, when you get to something like litigation, all of that is going to be scrutinized by the attorneys. One of the things that I learned is that you really don't want to have the plaintiff's attorney to have access to the EMR because, first of all, most people don't know how to navigate an EMR unless they've been taught how to do it. And sometimes they can take snapshots and kind of twist that information to make it look positive or negative. So the first thing that I'd say when you're in a situation where you've been served with papers from the attorneys is make sure that you try to keep the actual EMR out of the hands of the attorneys. So another reason that and what we're going to end up focusing is understanding the architecture of the EMR, but sometimes you're going to go into the forensics of an EMR just to troubleshoot and resolve technical problems, and that's often done either by the internal technical team or sometimes with the vendor or sometimes a partnership with both of those. So there can be forensics that are done to make sure that the EMR is functioning appropriately and to find the problems and fix the bugs. And then other times you're going to do forensics or if there's a privacy breach, certainly looking to see if people are accessing the record inappropriately or if we've had a HIPAA compliance problem that's going to go to regulatory compliance and certainly all the fines associated with that. And then the biggest thing is data loss. You might want to find out if you've lost portions or all of the EMRs. And certainly with all of the ransomware that's out there, many healthcare systems are experiencing that challenge as to do they pay the ransom or do they go back to their tape backups and restore the data. Nonetheless, there's always a little bit of data loss with technology. We know that, but hopefully you can minimize it with proper downtime procedures and backups. So let's go into the steps you take when your organization is named as a defendant. The first thing you're going to want to do is talk to the internal counsel. So your attorney that is going to be defending you, whether it's in-house or whether it's a firm that has been hired to defend you. I believe most healthcare systems either have one or the other. They have a firm that they're used to working with for all their legal issues, and oftentimes attorneys will work internally if a healthcare system is big enough. One of the things that I found is that oftentimes they'll depose everybody that's had access to that patient or that technology. And so first thing you want to do is find that EMR forensics expert because they will be able to explain the entire bucket of what we're looking at as opposed to many of the people that are deposed. They just have a small subsection of information. And I'll give you some examples. I remember when I was an analyst and building the applications for the end user in an EMR, I knew that specific application. I knew the tables, I knew the codes behind it and how they were all pulling into that specific application. But when you depose somebody that's an application analyst that's built just the end user piece of it, they may not understand the other 6 layers of the OSI stack, which technology is made up of. And one of the things that I also found is that when I read through the depositions, even some of the vendors that they deposed at that time didn't understand the architecture. So they could speak to things theoretically, and they could explain what their philosophy was and how things were supposed to happen. But all of us that are in technology understand that what is supposed to happen when you go end-to-end in testing the technology, it may not actually go according to what you think because, you know, somebody may have misprogrammed something, somebody may have misunderstood a workflow. And so looking at what individuals know or what the vendor knows may still not give you that architectural understanding of how that particular organization has built their technology and how you can defend it. The other thing that you'll find is an EMR forensics expert will be able to dispute some depositions. I know that when I was given the depositions to read over, and I was involved in this case kind of closer to actual litigation, so they had done a lot of depositions ahead of time, and oftentimes, again, because people understood just a simple piece of the puzzle, they couldn't speak to the entire architecture, and so you have to give your forensics expert the ability to dispute the depositions and speak to it in a very knowledgeable way. So being able to explain, I disagree with that, and this is why. So being able to get into that depth of expertise and showing why the answers that were given by that person that had been deposed were incorrect. And it's not because the person's purposely trying to mislead anybody, it's just because they don't know. So that gets to the statement about individuals caring for the patient or developing the EMR know a tiny fraction of the underlying architecture. Nurses and physicians typically don't have a depth of expertise to explain why stuff happened in the EMR. They know about data entry, they know about workflow, they know how to get the stuff in there. And I think when we began this charge towards EMRs, I think most of us were thinking about getting the data in and how do we get the reports for operational functioning without really thinking about, you know, what's it going to look like in the case of a litigation. The other thing, when you're picking that EMR forensics expert, make sure that you understand the credentials, the expertise, and the knowledge base of each individual. So in my case where I was defending this healthcare system and physicians, oftentimes the people that were deposed had just that subset of information. And I remember during one of the lengthy depositions, I had a 6.5-hour deposition where I was being deposed. And the 3 attorneys that were defending the physicians in the healthcare system, we'd step outside the room for a few minutes to take a little break, and they'd ask me what I was talking about because they really couldn't understand the depth of technical speak. And it was kind of a fun moment because they sent a junior attorney who didn't know the case well from the plaintiff's side, and she was very talented and she knew how to be an attorney, but she didn't understand the case and she didn't understand the EMR. So if she'd had anybody else, because she kept posing the question in multiple ways, she could have very easily tripped up somebody that didn't understand the architecture well. But she would pose the question multiple ways and she would say, you know, if you present it this way, and she'd try to get me to agree with her. You have to have somebody that's really strong in their knowledge to understand the architecture, to dispute, and to not feel intimidated by, you know, somebody who's an attorney. And opposing counsel, so the plaintiff's attorney will always try to damage the credibility of each of the people that are deposed or put on the witness stand. As it turned out in the case that I was involved in, I was one of the few people that was actually called to the witness stand simply because, you know, I know that opposing counsel called for several people that were not helpful to our case. Again, they were able to speak to their subset of knowledge, but they weren't able to speak to the architecture of the EMR. So opposing counsel wanted them so that they could damage the credibility of the people. And so you have to really, you know, coach some of these people. You don't want anybody to lie about what they know or to mislead, not knowingly. But again, understand that they have a limited knowledge base, and so that can unintentionally happen. So let's look at what plaintiff attorneys are looking for. They're going to be looking for errors. That's going to be the first thing that you're going to want to make sure that you can quickly ascertain whether there are errors in the record. And oftentimes you're going to be looking at within the database, or you may be looking at the documentation that prints out of the EMR, but you're going to be looking for errors, and that's going to be the first thing that you're going to want to make sure that you don't have those kinds of errors. They're also going to be looking for discrepancies in the record. And I'll speak to some of those in a little more detail as we go through the case study. But what we ended up with the paper record is the paper record was multiple sources of information. But when a counsel is presented or a jury is presented with that piece of paper, they don't understand what the time and date stamps are and how the data was rendered on that piece of paper, because what's rendered on the paper is not necessarily what you see in the database, whether it's historically or at the time of reviewing that database, and I'll speak to that in a little bit more detail. Another thing that they're going to look for is missing documentation, and that's one of the reasons that we've gotten away from the paper records is because it's very easy for a piece of paper in a paper legal medical record to go missing. We just have so many workflows and so many errors that are potential for missing that one piece of paper that could be key to proving that your care and your documentation was accurate and appropriate for that patient. There's also gaps in documentation that they're going to be looking for. So again, whether it's because people forgot to document on that patient, whether it's because a piece of paper got missing, or whether a technology such as a transcription and dictation system didn't import appropriately, if values didn't come back for any radiological studies or lab studies and those kinds of things. So all of those things, you have to keep those in mind as you're preparing for your case is do we have errors? Do we have discrepancies? Is anything missing? Does it look like somebody's trying to hide something because we lost that piece of paper or we didn't print out that piece of information when we printed out the EMR? Audit trails are going to be key to showing time and date stamps, and this was one of the things that I really had to educate the jury on is what does the audit trail mean? Because in my case, we were disputing when an allergy became active. So the record I was defending was a Cerner architecture, and one of the things that they do when you put in a no-known allergy, it date and time stamps who put that allergy in. And in order for a no-known allergy to be deactivated, you had to have the next person who was putting in an active allergy, it just automatically deactivates it. But the audit trail shows that on behalf of the person that entered the no-known allergy, this next person was deactivating it. And that was really difficult for the jury to understand, and certainly the counsel. The attorneys just didn't understand why it would say that, and I had to help them understand that that was an automatic thing that functioned so that the drug allergy alerting function would work. Because if it says no known allergy and an allergy to a medication, the drug alert is going to get confused. So that was a piece that I had to educate the jury on to give them an understanding of the date and time stamps of when exactly the allergy was put into the database. So anything that's confusing and any testimony that's confusing or deposition that's confusing, the plaintiff is going to love that because that will add to doubt that, or speculation that perhaps the healthcare system or the physicians or the technology department is trying to hide something. So anything that gets to be confusing is a basis for the plaintiffs to win the case. And the other thing that the plaintiff will do, especially when you're on the witness stand or in the middle of a deposition, is they're going to do this rapid-fire questioning, and they're going to try to get you to agree to something that might not be true. So they're going to keep hammering at you, and it's always a bit nerve-wracking sitting there in front of a judge and jury and watching the poor little wife of the patient that was, had a poor outcome because of his, just unfortunate circumstances. It's very challenging to try not to look like the bad guy because you're defending the hospital or the physicians, because you really do have a soft spot in your heart for the family and all the challenges that they have because of this patient outcome that may not be the best. But nonetheless, you have to take your time, and when the attorneys are throwing these questions at you very quickly, it's important to take a breath, think about what they said, ask them to repeat the question. And you can do that numerous times because it gives you two things. One, clarity on what they're asking for. B, time to think about, is that true? And C, coming back with an answer that's intelligent and true. So beware, the attorneys are very skilled at trying to get you confused and agreeing to something. And they'll take a small subset of the information and they'll say, do you agree with this date and timestamp? And that may be that I agree with the date and timestamp, but again, I was able to say yes, but the reason that this rendered the way it did, and I'll get into a little detail about that a little bit further on, is understanding what that date and timestamp meant, and at that time what the architecture was of the database that pulled the information the way it did. So I guess I've spoken to some of these things. Repeat the question to make sure you understand it, and that gives you time to formulate a clear and concise answer. You want to make sure that your answers are concise, because the more convoluted your answer is, the more difficulty the jury will have in understanding what you're talking about. So think very carefully before answering a question. Your adrenaline's going to be running, and you're going to be sitting there on the witness stand, and you're going to be feeling like you have 1,000 eyes pointed at you. But you really want to make sure that your answers are going to be succinct and clear. And you need to make sure that you're speaking to an audience of lay people and not technology or healthcare people. So many times people are going to use the terminology that's familiar to them because that's the environment they work in. But the jury doesn't understand that. So when you answer, you want to make sure that it's clear, succinct, and in layman's terms so that they don't have to answer a lot of the questions, or they don't want to ask a lot of questions at the end of the case. You also want your expert, your EMR forensics expert, to speak with authority as if they know what they are talking about. So the worst thing that you can have is somebody that's very tentative about their answers. And when I read through a lot of the depositions, you could understand that the depth of technical expertise that they were being asked to speak about, the person that was being deposed, they didn't understand, and so they'd kind of stutter and not have a firm answer. So there were lots of ums and ahs and head nodding and that kind of thing. And in the middle of a deposition, a head nod is not acceptable because there's somebody transcribing everything that you say. And so the attorneys will say, are you answering in the affirmative, or are you saying yes? And then you have to actually say yes. So make sure that your forensics expert can answer with authority and really a knowledge base that's going to be helpful to winning that case, because the jury is really going to be watching for those verbal and nonverbal cues that say this person knows what they're talking about or doesn't know. And if you don't know the answer to a question, it's fine to say so. And sometimes in depositions, they'll ask you to follow up on that. And so it's really important to not, answer something incorrectly. It's better to follow up with an answer to it later so that they can make it as an addendum to that deposition. It's okay in a court of law to say you don't know something. That also helps the jury understand that you're credible, that you're willing to say, I don't know everything, but I'm going to tell you the things that I do know. Another thing when you're on the witness stand is you really want to develop rapport with the jury. because they're going to be key to you winning your case. If you don't look at them, if you are just looking away from them, they're not going to trust you as much. So when you get the ability to stand up on the witness stand and you know, the counsel that you're working with will ask you to speak about your credentials, you want to speak with authority about your credentials. Tell them why you're the expert they should be listening to. Look at them and smile. I tell you, the smile goes so far because it builds that trust immediately. So you want to speak clearly, with authority, and loud enough for the jury to hear, but not so loudly that they feel like you're yelling at them. So building that trust, that relationship, you have depending on how long you're a witness in the witness stand, you may have a short period of time to build that trust and relationship, or it could be an extended period of time. But remember, the entire time you're sitting there on the witness stand, that jury is looking to you to answer the questions that they have in their mind as to whether the hospital or the physician is guilty. Medical litigation is a very lucrative business, as we all know. Hospitals and physicians get sued a lot because many people are hurt. Their family member may have been damaged because of an unfortunate healthcare incident, and there's a lot of cost associated with it. And so there's a lot of emotion that says, I'm angry and I want somebody to pay for what happened to my family member. So your forensics expert has to come up there without the emotion, but with the facts and with that trust and with that credibility. Keeping your terminology simple and explaining the concepts clearly is so key because, you know, I don't know how many times I sit in a meeting, and whether it be with a vendor or whether it be with somebody in a department that I'm not familiar with, and they'll throw around these TLAs. We always kid about the three-letter acronyms, the TLAs, because every discipline has them, and they understand it if they're working within their discipline. However, when you take it to another forum, not everybody's going to understand the three-letter acronyms. And so I'm very quick to say, I don't know what you mean by whatever acronym that's been thrown out. And I remember one time meeting with a vendor, and a physician afterwards said to me, what's PTO? He didn't know that was paid time off because the terminology wasn't familiar to him. So anyways, make sure that you keep the terminology clear, make sure it's simple and in layman's terms when you're speaking to the jury. And at the end of the testimony, you know, in the questioning, then the jury has a chance and the judge has a chance to ask you questions. Again, it can be very intimidating having to have the judge ask questions for clarifications or to have the jury submit questions. In my instance, I had the judge sitting on the right-hand side of me and the jury was to the left-hand side of me. So I purposely turned towards the judge when he asked questions, and if it was the question that he posed, I'd answer him. But if it was a question that was posed by the jury, I'd listen to the judge, I'd validate the question, I'd repeat the question to make sure I got it right, and then I would turn to the jury and answer the question so that they heard and saw my facial expressions and that they understood that I really knew what I was talking about. So that's another moment that you're going to get that intimidation factor because you really want to win this case. If you're the expert defending this hospital or these physicians, you want to. And so you want to get the jury buy-in. So smile at them, let them know that you care, that you are providing your testimony not from an emotional standpoint, but from a knowledge base that's credible. So a couple of key things that we need to think about ahead of time is what's your hospital policy and what your legal medical record is. Is it paper only? Is it EMR only? Or is it a combination of the both? And depending on what venue this medical record is going to, whether it's a transition of care or whether it's litigation, you need to understand what what your hospital policy is and what they define as a legal medical record, because that's also something that's going to be called into question in a jury trial. You're also going to need to have experts that understand the workflow, the terminology, the technology, and the clinical outcomes. In my case, that was key to helping the hospital and the physicians get off, get off of having to pay millions of dollars. And also, you want to have experts that can translate into layperson's terms. So I see we're getting close to the end of the time, and I'm going to start moving this along a little bit faster. So your EMR forensics expert has to understand the entire architecture. There are 7 layers in the OSI stack, which is the technology stack, everything from the user interface to the database to the transport layer to the network to the hardware. All of those pieces need to be understood. You want an expert that can develop rapport with the jury. Many people that work in technology may not have some of those personal skills. So you want somebody that can clearly articulate and describe the functionality without using techno-speak. And back to the no 3-letter acronyms. You need to have an expert that's able to have credibility by experience, training, and education. And when that person does speak to their credentials, make sure they do it with authority. Listening to the questions, I think we've discussed this in great detail. Your defense counsel will aid you in bringing out the key points. So if you don't say something clearly, they'll ask you pointed questions so that you can add clarity to your answer. By the same token, your opposing counsel will try to lead and confuse you. So in my case study, we had a 67-year-old male that presented to the ER one evening, and he'd had some comorbidities and different health conditions. He was about getting confused, and so his wife brought him in. They did a triage, and in the EMR they noted that there were no known allergies, and they did some diagnosing, some labs, gave him some medications, and determined he had an infection. So they sent him home, discharged in a stable condition on antibiotics. It wasn't but about 6 or 8 hours later, the patient was brought back to the ER, and the patient was admitted and treated. And one of the things that they thought was happening with him at that time was a stroke. And so they started this patient on heparin, initially on subcutaneous heparin, and then ultimately on IV heparin to try to prevent a stroke from happening. They did a TEE, or a transesophageal echocardiogram procedure, and they were trying to just really figure out what was going on with this patient. Nonetheless, somewhere along the way, they noticed that the patient was diminishing in their mental clarity, and so they discovered a cerebral hemorrhage that caused permanent brain damage on this patient. And so the plaintiff was trying to say that the hospital gave heparin inappropriately because the patient was allergic to heparin. And so that gets back to the date and time stamps as to when the allergies were entered, and explaining why they canceled the no known allergy. So in my case, it was September when the patient had the no known allergy put into the EMR, and then the bad event happened in the month of September, and then in October, somebody put in a heparin allergy. And so the date and timestamp showed that, and the attorneys and the jury were questioning why there were so few audits in the allergy audit trail, because there was simply no known allergies entered in September, and then that was canceled, and the heparin allergy was entered in October. So being able to explain that to the jury gave clarity that the hospital and the physicians didn't inappropriately administer heparin for a heparin allergy. And so the physicians were able to get off on their piece of the litigation, and being able to explain that the EMR was was accurate. It was the paper that was inaccurate. And so we were able to get the hospital discharged from the case. So, Anthony, I know we're getting close to the end of our time. I can speak to a little bit more about the printed records.
Go ahead. Take your time. Take your time.
Okay. Okay. So we've spoken about the allergy, but when they printed out the paper records, the footers were key to proving what happened when. So we had what happened at the time that the record was printed out, or at the time that this whole issue happened, is when you get an EMR and you print out, you're pulling from database tables in the EMR, and you're trying to make it print out so that it looks like a transcribed and dictated document. And what happened in this instance, and this is a bug that was in the Cerner application many, many years ago, is it was pulling from the latest allergy as opposed to the historical allergy. So back to the September timeframe where the allergy said no known allergies, what happened when they printed out the document, it was pulling the latest allergy that was entered in October. And so the footers would indicate when that document was printed, and I was able to tell them that that was printed on that date, so it was pulling from the latest allergy as opposed to the historical allergy. So footers and date and timestamps are really key, and understanding how that information was rendered onto that piece of paper is key, and being able to explain what the date and timestamps on the printed record mean. One of the things that helped us, at this time they weren't on CPOE, and so the handwritten physician orders were also helpful in showing that on the handwritten orders it said no known allergies for the entire month of September. So that was, I had to explain to the jury that that was a static piece of information and nobody could go in and alter it because it was handwritten and scanned in. Then the other question came in with the transcription and dictation, and that was a foreign system that the physicians were dictating into. It was transcribed and then it was imported into the system. Those date and timestamps were also helpful because it showed that at the time of the dictation, the doctor said no known allergies, and I explained to the jury that that could not be altered in the medical record once it was scanned in. So to sum up, you know, the audit log was key to it, but understanding how all the other pieces of the paper EMR came to be and how they were rendered onto that paper were key to helping us win this case. So the case was dismissed. The physicians were dismissed earlier because they were able to dispel the heparin allergy, just because, you know, the function of heparin is to make, you know, your blood coagulate less. So the physician cases were dropped, but the technology architecture and the forensics was key to dismissing the case against the hospital. So in my opinion, I think this is a brand new field that people will begin to have to explore a lot more. And I think we're going to have a lot more cases with paper printed documents versus the EMRs, and being able to explain them is going to be key to supporting our physicians and our hospitals against litigation.
Okay. All right, Kathryn, thank you very much for an excellent presentation. Now I want to remind everyone to go ahead and send your questions in, and we'll get them in front of Kathryn. Leave the default set to all panelists. Kathryn, let me start by asking you a little bit about this EMR forensics expert that you mentioned a number of times in your presentation. I assume this is an outside consultant. Is this someone who's on retainer with the hospital? Is this someone you have to go out and find at the time of an incident? Do you want to research this beforehand? Tell me about this individual.
Yeah, so the people that truly understand the architecture of how the system is designed are going to be people that have worked with it a lot and in multiple capacities. And so being part of a whole design and build and testing and deployment of an EMR and having kind of oversight over the entire process are going to be the people that you're looking for. And as I mentioned to you earlier, Anthony, when I was doing a huge EMR rollout for a publicly traded company, the first person I hired was somebody that I knew that knew the product extremely well because she had functioned in many of the applications and she built it. And over the years, I had worked with her as a consultant, and she was able to educate me on how the stuff actually worked in the technology. So you're going to want to find somebody that truly understands how all the pieces fit together. And I think those are going to be few and far between. I believe that most healthcare systems that have a huge EMR rollout do have an architect. Again, can they speak to the architecture, but also can you put them in front of a jury to speak to it intelligently without the TLAs?
So this is not a sort of a neutral third-party individual necessarily. This is someone from your team that can really answer technical, detailed questions.
It can be both. I think that you're going to get, if you have a third-party person come in, that person has credibility because they are not seen as being one-sided in their opinion. So in my case, I was an expert that came from the outside. The health system knew me, which is why they asked me to be that expert. I had done some consulting for them, but nonetheless, I think if you have a third-party person, it gives it more credibility, and the jury will trust them more than somebody from the inside.
Very good. Now, you have a clinical background. How much did that help you in your testimony or in your courtroom experience? And any advice for CIOs who find themselves in this situation who may not have a clinical background?
Sure. I'm fortunate in that, I can speak to the clinical workflows and the clinical terminology. So I think it took me less time to understand some of the workflows and what happened in that situation, and I didn't have to spend a lot of time looking up the terminology. I think if you have a CIO coming into the situation that doesn't understand the medical piece of it, they're going to have to do a lot more research and spend a lot more time coming up with an opinion on the forensics.
Okay, very good. And just as a final question, do you recommend or did the lawyers initiate sort of a mock cross-examination with you?
No, they really did not, because first of all, they don't want to be seen as tampering with the witness. But they did kind of walk me through the process and the procedures, and they really told me some of the things that I have spoke of today is think about the question, repeat the question, take your time, make sure that you have time to formulate your question articulately. So they will coach you on the process, but they don't go through mock. I think the depositions are really kind of the mock trial.
Mm-hmm. Mm-hmm. And so just finally, do you feel like you were treated respectfully by opposing counsel?
I was treated respectfully. I think they were they tried to be tough and they tried to shake me. A 6.5-hour deposition is extremely taxing, both emotionally and mentally, and without eating and that kind of thing. So it was very, very interesting. But you have to be strong in your knowledge base to be able to defend, the EMR. And so understand that that attorney doesn't know everything that you know, and you just have to prove that you know what you're talking about with clarity, with authority, and with rational explanation.
Yeah, and finally, as you said, it's okay to say, I don't know.
Exactly. I think many people are afraid to say that, and I'm the first one to stand up, and there are no stupid questions. If I don't know something, I would rather get the right information than to be proven wrong later.
Very good. Well, Kathryn, I want to thank you so much for that wonderful presentation. I would like to ask everyone, when you close out your window, take a moment and answer our post-event survey, and you'll get an email when our archive is posted to our YouTube channel. For those of you who have the CHIME CHCIO certification, make sure you remember to let CHIME know you were here, and if you've asked us to do so, we will. If you'd like to have us produce a webinar on a topic of your choice, either a single presenter or with a panel, please contact Nancy Wilcox. And if you need a certificate of attendance for another CEU program, you can use the final slide in this deck. And finally, please go to our site. We've got a nice, robust list of upcoming events. So again, I want to thank you, Kathryn, thank our audience, and everybody have a wonderful day.
Thank you, Anthony.